Dr. Ross talked about the patient experience a lot. And I think part of the success that Dr. Pope was talking about in his practice is how do we present this to patients? What is the experience like for a patient? Because unfortunately in dentistry, we still speak that foreign language, and we speak it to our patients, right? You come in for a hygiene check, and your hygienist says, hey doc, I want you to check the mesial of 14 and the distal of 29, and they've got an MOD here, and they've got that, and so you just don't know what that means. And so from a patient experience perspective, our scanner really focuses on not only being able to conduct clinical dentistry with ease of making these processes really simple and efficient, but also enhancing that patient experience and enhancing their education. Because there are tools that are built within iTero that don't exist in any other ecosystem that allow you to kind of help that patient understand the dentistry that you're prescribing. And for me, that's what I am most passionate about with iTero, because it's great that we can conduct all this clinical dentistry. We've got to know, and I will second what Dr. Pope says. This is an amazing revolution that's happening as all these workflows are integrating and all this stuff is coming into play. And we've seen doctors that kind of lost their passion for dentistry be completely revived by being able to have something new to be able to think about and different ways to treatment plan. Or even doctors who had one that had to retire because of some shoulder stuff, but now he does all of the treatment plan. And so his mind's still there, even if the physical tools aren't there, and being able to help partner with these other offices to be able to do some of this design work and case planning and case management stuff. So it's got a lot of versatility within the practice. But the patient education tools that you provide, I want to spend just a few minutes talking about that, because I think that's really a differentiated value proposition for iTero in being able to communicate that in many ways. And if you've never been into, I don't think anybody's got to go to your practice, right? Maybe a couple of them.
No, here.
Okay.
No.
They take this so seriously that at the foot of every chair, there's a TV screen that's that size right behind you. And the reason for that is because they want to be able to really educate these patients and help them understand what they're trying to explain to these patients. It's not something that they're like, here's what it is, here's what it looks like, here's why. And they use all the tools, the CBCT, intraoral photographs, the digital scan, to be able to kind of help them understand all of these tools. And I'm going to, if it's okay, I'm going to just show a couple of those things real quick, and how that experience can change for these patients once they take a scan. Because as soon as they take a scan, we have the ability to turn the scanner around and show them, or because we are a cloud-based system, I can pull it up through that TV or through here and move the scanner into the other operatory to take the next scan. And I think that a lot of people miss out on that opportunity, even when they buy the scanner. I mean, Dr. Pope talked about the change model, right? You try it and it doesn't go well, so you go back to what you know. But everything with the change model is, you're here. In order to get here, you kind of go down that little valley first to climb up to the next mountain. And that experience happens with everything. It's going to happen to your team with scanning, but we've got a great workflow. We've got a great team that does training and will help you with that implementation. But from a patient perspective and a patient perception, when you take a scan, and whether you do this here on the scanner or whether you do it in the cloud, the first thing that when the patient sees it, they say something like this: "Oh my God, are those my teeth?" And it's amazing how engaged that they become in it. People will literally like reach up to the scanner and start moving it around and seeing what's different and seeing what's changed and asking you questions, and they're exposing to you what their goals are. And that's one of my favorite things. They're telling you like, hey, I don't like this, I don't like this, I don't like this. It's like looking at a picture of yourself. When we look at a picture of ourselves, are we like super optimistic? man, this is a handsome man. I look really buff today. No, it's, oh my God, what happened to all my hair and how did I get so fat? At least that's me. And so being able to kind of have that perception with the patient, it really kind of uncovers what they need to know or what they understand. Let's see, they didn't like that case. And so being able to have that conversation with the patient at real time makes a big impact. And then you can take it to the next level, and you can say, hey, let me show you something that concerns me. And what I love about that is so often, I think of a new patient experience. When a new patient experience happens, they come into your practice and they haven't been to the dentist. It's easy 2 years because there's no reason that they had to go to the dentist because there's a global pandemic going on. And we look at them and tell them that they've got thousands of dollars worth of dentistry that needs to be done. And it's true. It's legitimate. It's probably double that amount of dentistry at times. But they look at us and go, this is why I hate coming to the dentist, because you guys are always after my money. And it's the only profession that I know that people make medical decisions about their health based upon the cost of the treatment. Right? If we take a patient if we take one of our kids to the doctor and the doctor says, hey, you need this, your insurance doesn't cover it, give this medication to your kid to make them feel better. There's any amount of money that we wouldn't pay for that, but all of a sudden when we tell somebody they need an implant, or they need a graft, or they need orthodontics to help protect their bite, whatever it is, that the patient's like, well, I really can't afford that.